Over the past year, we have continued to bring you stories about mental health, something that needs to be talked about. Testings and challenges that are associated with this still brewing in a conversation.
But this morning, we want to focus the conversation around teens. Studies show that 46% of parents say their teen has shown signs of new or worsening mental health since last March. It's an important conversation to have and sometimes hard for families, but now it's more important than ever.
Friday night, I still remember it. I asked if I could go be euthanized. Saturday morning, I woke up and there was like police in my room and they handcuffed me and took me to the hospital.
Nick Rubin is a senior at East Grand Rapids High School, 18 years old and wiser beyond his years. But back in February, Nick wanted to end his life.
I think that a lot of depressed people don't necessarily feel sad, it's just that they feel numb. And that was what it was like for me.
Today, he stands here with a powerful message to share.
You're not alone. Even though I heard that a million times, and even saying that you know other people do struggle, you still feel alone because everybody hides it.
Nick's mental health journey started back in middle school, and once he got into high school, the pressure only intensified.
I have to step it up, I have to get these grades, there's so many expectations, and I just couldn't keep up with that stuff. That depression has been with me for a long time, and for the longest time, I didn't really think it was depression. I thought I was just, losing interest, as most teenagers do with old stuff. Like, oh, I was a kid back then. I probably don't find it fun anymore.
When Nick finally realized it was something more, he said he just ignored it because coming to terms with having depression was hard.
I had this saying that I lived life on autopilot. I kind of just did what I had to do to get through the day, Went to school, did my classes, go home, play games, go to sleep, repeat. And that was not a good way to live my life, but it's what I did for almost 7 years.
Just 2 months ago, Nick was ready for his life to end. His parents ended up having him involuntarily admitted to Pine Rest.
In my head, I was like, I'm gonna discharge from Pine Rest as soon as possible, and I would rather be homeless than live in my parents' house again. But when I went to Pine Rest, and I was like, okay, I'm gonna get the most of it as I can. And I went to every group session, I did everything that was required of me. And I started to see actual changes.
Changes he hadn't seen in years.
By Saturday night, I was like, I forgive you, I said on the phone to my dad. I said, I understand why you did what you did, but I wish it didn't have to be like that, but I understand why you had to do it.
Nick continues to put in the hard work in and out of therapy to get to where he is today.
There were so many times where us as parents felt just abandoned by any hope. And to see how Nick has taken the lessons that he has learned and turned that into something that he can not only embrace, but he can use to not only improve himself, but others around him, for me, has been so inspiring.
Nick's story isn't uncommon. In fact, the CDC says between April and October of 2020, ER saw a rise in visits from kids with mental health needs. In fact, suicide is the second leading cause of death in youth ages 10 to 24. And over the past year, 1 in 4 young adults have contemplated suicide during the pandemic.
I think it's more so giving the parents the confidence to say, like, all right, I'm going to jump in and have this conversation, because the fear really is, what if my child tells me they're suicidal? Honestly, a lot of times it is us who are uncomfortable. It's like, well, what are you going to tell me if I start this conversation up? What am I going to be blamed for? Is it my fault? Am I not giving you enough things to do? Do you think I'm mean? Like, no one wants that spotlight back on them. And I think that this is really the area to take away our egos, right? Like, I'm coming in to help you, and I'm not perfect myself.
We're closer than we've ever been in our relationship. And I think a lot of that is just because of not only what I've done to help myself, but what they've done as well. Because it's not a one-sided thing. They've been working their butts off to help me as well.
My message to parents is to spend enough time with your children to truly recognize the signs, the symptoms, and every little thing that you see. Be open to talk about it. And when you talk about it, don't try to fix it right away. The idea of talking is just to have an open discussion and let your child know that you know, let your child know that you care, let them know that you love them and you are willing to accept them the way they are, and that through all of this there is hope.
I think hope is the most important thing when it comes to mental health, because if you have no hope, then there's no reason to try.
And that's exactly what Nick wants others to know. A young man just 2 months ago, facing his darkest days, can now see the light ahead.
Not only am I still going through it now, like I'm still making decisions, I'm struggling, and I'm sometimes failing, and that's okay. I've learned about like acceptance and vulnerability, and those are very important. Understanding that life, there's gonna be bad spots in your life, and that's a part of life. So trying to protect yourself from not feeling bad will make you not feel at all, and you won't feel good either.
Now, if we look in depth at some of the signs that your teen might be contemplating suicide, you can look out for emotional pain, distress, anger, significant changes in mood or behavior like becoming very irritable, withdrawing or isolating from activities that once brought them joy. Also keep in mind that depression might look different in teens than adults. Teens may experience more of that irritable mood rather than sadness.
Nick has also been involved with the Be Nice organization, working to spread his message to others.
So program director from the Mental Health Foundation of West Michigan, Kat Lanting, is joining us now with tips for parents, plus an upcoming event. Thanks so much for joining us this morning.
Hi, thank you.
So first I want to talk a little bit, obviously we were connected with Nick through your organization, and just talk about, why it's so important for him to be willing to open up and share his story. And I know he'll be speaking at one of your events coming up as well.
Yes, so stories like Nick are so important because oftentimes who is watching this story this morning, right? Who is young people, but also parents. And I think we can't ignore the different backgrounds and different generations that we are as parents. And his story is so interesting because he started realizing, when you read it, these changes in elementary school, through middle, through high. And when you listen to that, you can really get an idea of what he was going through. And us as parents and adults, I loved what the counselor said during his story, is starting that conversation early and often is super important when you start to notice those changes.
Mm-hmm.
Most definitely. Now, not everybody is as lucky as Nick to have the guidance that he'd received that saved his life, essentially. Where do we stand with current numbers with regard to suicide here in Kent County?
So Kent County, that's a really tough one because we talk about yearly rates. And I'm not going to put the numbers on right now, but we know that we're going to see a spike possibly in 2021. We know we have higher risk factors right now. And now, more important than ever, it's important to talk about the question of how can I get more information about signs and symptoms? We know that the highest rate is amongst Caucasian males ages 34 to 54. With teens, it sits about the second leading cause of death for them right now.
Wow.
And in Kent County and the Lakeshore, we're seeing an increase in the last couple months due to increased, risk factors that we're seeing. So it's important to have those conversations and get the person to the right help as soon as possible.
Absolutely. And talk a little bit too quickly about the resources that your organization has and all that you offer to help the community.
Yeah, so the Mental Health Foundation of West Michigan has the program Be Nice. So what we offer is an action plan, and we have K-12 programming. We also have programming for businesses and faith organizations, really anywhere where someone can learn an action plan to have a conversation. So we say have these conversations, but how do I really start it? So our action plan is to notice. So we're going to talk about those, Deanna, those signs and symptoms that you just mentioned. We'll practice those. We'll look at what is typical adolescent behavior. So when Nick started to feel that stress or that maybe I'm not good enough, is that typical? When do I start that conversation? Inviting is practicing having that conversation, right? Here's what I've noticed in you. Here's how we can open up these conversations. Challenge is about reducing stigma, right? So we all came up with different ideas about mental health. So we're laying the groundwork to have everyone have a basic knowledge about mental health so I can have the confidence to take action. And empower is really that action of getting the person to the appropriate resources. So we at the Mental Health Foundation do not provide resources. We empower individuals within their communities and organizations. So Nick at his school, empowering his parents to understand the resources that are available to him as a student of East Grand Rapids.
Absolutely.
What resources are available to me as an employee of my employee assistance program, right? My employees and their families can take advantage of that. So it's really making us all aware of the resources available. So we're more of the education service, but that's where we have to start, because many people might not have the confidence, again, just like that counselor said earlier, to have those conversations. So we're going to give them that knowledge, and then they move right on up to have the confidence to say, hey, I'm concerned about you. Here's what I've noticed in you. And I do know that these resources are available.
Some life-saving information right there.
Thank you so much for your time. And Nick will be speaking at that Stomp Out Stigma Walk happening on May 15th. We'll get more information posted for you about that if you would like to take part.
It's 7:17. Let's check in with weather.